Good evening, everyone. I am Dr. Siddharth, Consultant Cardiologist practicing at SH Medical Center, Kottayam. In today's session, we will discuss about the role of healthy diet to keep our heart healthy. Normally, in a healthy person, the blood pressure rises and falls throughout the day. But higher blood pressure, which is higher than normal for a longer duration, can cause damage to our vital organs like heart and kidneys. A persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Hypertension has got no warning signs and symptoms, and many people even do not know that they have it. Thus, it is frequently known as a silent killer. High blood pressure increases the risk of cardiovascular complications like heart attack, heart failure, arrhythmia, peripheral artery disease, and stroke. Heart diseases are the #1 cause of death globally, and more people die annually from cardiovascular disease than from any other cause. Cardiovascular diseases are one of the most common the causes of the cardiovascular diseases are one of the common lifestyle diseases that we know of. Some most prominent risk factors for cardiovascular disease include sedentary lifestyle, stress, excessive salt intake, junk food, smoking, and excessive intake of alcohol. Nowadays, numbers of safe and effective medicines are available to treat hypertension and other heart diseases. But let me tell you, all that lifestyle modifications like exercise and dietary changes are equally effective as medicines and can also help a person to lower high blood pressure and prevent progression of heart disease. Hence, certain dietary changes like DASH diet and Mediterranean diet have been engineered to reduce the high blood pressure. In addition to this, specific dietary changes are also needed to manage uncontrolled hypertension. We will discuss these changes one by one. The first and foremost dietary change is reducing salt intake. A high sodium diet is well known to increase blood pressure, and packaged and processed foods are the main source of salt in diet. Human body requires a very small amount of sodium in the diet, approximately less than 1500 milligram per day. But however, most people consume more sodium than they need. And usually our consumption is more than 3 grams per day. And in fact, the less sodium you eat, the better blood pressure control you might have. To lower the sodium in diet, one can try these measures. Using a food diary to keep track of the salt in the foods you eat, increasing the intake of salt-free foods such as seasonal fruits, aiming for less than 2.3 gram or 2300 milligram, about 1 teaspoonful of salt each day, reading the nutritional facts labeled on each food package, avoiding foods that have 20% or more daily value of sodium intake, and avoiding canned foods, processed foods, junk, and fast foods. Second important dietary change that we can advise is limiting alcohol intake. Drinking excessive amount of alcohol increases the risk of developing heart disease. People who consume more than 2 drinks per day have an increased risk of heart complications as compared with non-drinkers. And binge drinking, that is consuming 4 to 5 drinks within 2 hours, is an even greater problem for overall cardiovascular health. Hence, it is very important to lessen the alcohol intake to have a healthy heart. Third dietary measure would be cutting down the number of tea and coffee. Tea, coffee, and other caffeine-rich drinks can increase the blood pressure. It is fine to drink tea and coffee as part of balanced diet, but it is also important that these drinks are not your main or only source of fluid. Drinking more than 4 cups of coffee a day may increase your blood pressure. So restrict your caffeine intake to less than 2 coffees per day. The fourth dietary advice would be eating more fiber, fruits, and vegetables. On the other hand, potassium, magnesium, and fiber may also help control blood pressure. Fruits and vegetables are high in potassium, magnesium, and fiber, and low in sodium. Many breakfast cereals are excellent sources of dietary fiber. Always stick to whole fruits and veggies. And it's better to avoid fruit juices because fiber of the fruit is destroyed and there is generally higher added sugar. And nuts, seeds, legumes, lean meat, and poultry are also good sources of magnesium. Combining these dietary changes with proper diet plan can significantly reduce one's high blood pressure and prevent heart disease. One of the most well-known dietary strategies for reducing risk of heart disease is the DASH diet. Let us see what is the DASH diet. DASH stands for the acronym Dietary Approaches to Stop Hypertension. It is a diet designed to combat high blood pressure and reduce risk of heart disease. Emphasizes on right proportion, size, and variety of foods and nutrients. Basically, it is an eating plan which is rich in fruits, vegetables, whole grains, fish, poultry, nuts, legumes, and low-fat dairy. It doesn't require any special or pre-packaged meals. Rather, it relies on many standard foods one may already have in their homes. The DASH diet cuts out desserts, sweetened beverages, fats, red meat, and processed meat. A typical serving guide for patient following DASH diet and goals for less than 2,000 calories a day can be: grains, 7 to 8 servings a day; lean meats, poultry and fish, 2 or fewer servings a day; vegetables, 4 to 5 servings a day; fruits, 4 to 5 servings a day; low fat or fat-free dairy products, 2 to 3 servings a day; total sodium intake, 2.3 grams per day. And nuts, seeds, dry beans, 4 to 5 servings a week; sweets, 5 or less servings a week. This is all about the servings of a DASH diet. Moving on to Mediterranean diet, it has many similarities with the DASH diet, but it is generally higher in fat, primarily monounsaturated fat from olive oils, nuts, and seeds. And commonly, the fat content comes close to around 40% of the daily energy need. Let us talk over how these healthy diet plans can improve the heart health in patients having cardiovascular complications. Diet encourages the intake of foods rich in potassium, magnesium, and calcium, and helps in reduction of sodium in the diet to about 1,500 milligram per day. The DASH diet generally includes about 2,000 calories daily. Due to the avoidance of fat-rich food, it reduces triglyceride level, improves HDL, and also reduces LDL. Hence, it can be worked as a successful tool in weight management also. Diet plans also cuts intake of sweets and sugar-containing beverages. So this lowers the risk for development of diabetes and other heart diseases, and also helps in maintaining your body weight. And such dietary plans which reduces glucose sodium intake improves health of the patients with heart failure. The healthy diet eating plan is just one key part of a heart healthy lifestyle, and combining it with other lifestyle changes such as physical activity can help you to have more control on the blood pressure and LDL cholesterol for healthy heart. Accompanying healthy diet, person should also get at least 30 minutes of moderate intensity exercise most days of a week. Examples include brisk walking or riding a bike. Person can aim to get at least 2.5 hours of exercise per week. At this time, I would like to suggest some ideas that can help you make healthy changes. If following the diet is difficult at first, start with the small achievable goals and try making 1 or 2 changes at a time until you can do it all. First one is learn to read labels, so that by knowing the serving size, you will get to know how much sodium you are getting per serving. Use spices and herbs to flavor your food instead of salt. Choose fewer processed foods, as these contain more sodium. Look for foods that say no salt added or sodium free or low sodium. Avoid fried foods. Grill, steam, roast, or poach your foods instead. Slow down when you eat and have a regular exercise. Lastly, the bottom line is diet plays a crucial role not only in developing but also in controlling the progression of heart disease. I advise to all patients to adopt a healthy lifestyle, which plays an important role in not only treating heart complications but also in preventing it. Thank you.